Good morning, everybody. I want to thank you all for taking the time to join us. This is a much anticipated opportunity for all of us, and we are grateful for our first speaker this morning, Sharon Lee Trefry. As you know, is the state school nurse consultant for the state of Vermont, and she is also the president of the National State Association of State School Nurse Consultants. If you have questions, please use the chat boxes. We'll be monitoring that. You can also always send questions to the COVID-19 at VSSNA. We will try to address as many as possible today. And as you know, in the next couple of days, we'll have this presentation posted, as well as the written notes and responses to the questions.
Hey, Soph, it's Brina. I just wanted to make sure you knew
I'm so glad you're here. Thank you.
And I have until about 9:51, 9:52. So
okay.
I didn't know if you wanted me to kick it off with some stuff with my.
Yes, ma'am. We sure do. So, Brina, I'm glad you're here. We were kind of watching for you. I'll introduce Brina Home. We've had her speak before. She is the Director of Maternal Child Health at the Vermont Department of Health, and our guiding light, Brina. So we're really excited you're here.
Well, you guys know that you're my guiding light, so that's a mutual admiration society. I wanted to start this morning by saying that we're hitting a new place in the sort of engagement around these reopening conversations, and so I just wanted to share with you a few reflections. So we did announce, well, the governor announced last week, and then we followed with health guidance that childcare is going to reopen on June 1st. And the guidance, which maybe Sharon Lee already sent you, will send you right now, went live yesterday. It's for childcare summer, including day camps. And then we say after school programs because that's just a confusing term. As you know, your after school colleagues have stepped into the emergency care arena for school age kids, many of whom partnered with you all, sort of the perfect model to provide that emergency care during March and April, May. So I wanted to make sure to level set this morning that the public health leaders, including me and Sharon Lee, we fully support reopening childcare. It is time. The data and the epidemiology make it the right time. And our kids are isolated, experiencing social emotional disturbances and distress, and that there's a whole sort of strengthening families frame that we need to put on this to get back to our children, their protective factors, their need for connection, developmental opportunities, joy. And unfortunately, we're finding ourselves in a nexus of fear and some politics, and childcare providers, for the most part, are embracing the materials, learning how to do this in a healthy way, safe way, and on board. But there's a very vocal group saying dangerous, and saying that it's being driven by the economic forces of our state needing to get back to some business and some of our work. So you guys are such a good group of people to think through things with me, because you sit in this interesting place as well, where you're health experts, but you're in buildings with lots of other types of leaders. And that's where we find ourselves today is, I know you trust me. Like, I would not let kids back into childcare if it wasn't safe. But as I've told you in the past, nothing we're going to do in this next year is without some risk. So I just had to start there because it's really activated today. There's some protests planned, and you're going to hear a lot in the news that we're doing something unsafe. And what I love about this group, just call us, email Sharon Lee with what you're hearing, get us in on where are the sticking points here about what's not safe. Do you not have enough supplies? Like that's the driver here? Then stop everything and we will get you those supplies. Like, are you afraid of kids with special health needs? Well, as we talked about, that group is going to have some exclusions. They can't enter into these group settings for all the reasons described about vulnerability, on and on. So I didn't want to take all the time to do the punch list, but I wanted you to know that the data is driving all of this. We have tested hundreds and hundreds of people, and we have under 5 positives a day now for 3 weeks. Like, we had 2 days in a row that earlier this week, 0, despite a very massive testing push from the governor. And we can talk about that if you want, because the testing push is now about asymptomatic people, because we don't have symptomatic people in Vermont. And, we pushed the docs and said, get everybody with a runny nose to swab. And the doc said, there's nobody with a runny nose. So I'll stop there. Those were my opening remarks. I have my closest friend from residency in Seattle. His name's Dimitri Christakis. He's very famous. He leads the Child Health Institute in Seattle. And he did all that research in the 90s that kids that were more exposed to television under 3 have higher rates of attention deficit hyperactivity disorder. Anyway, he was on Morning Edition this morning. I encourage you to go back and listen. He also did he's the editor of JAMA for Pediatrics, Journal of American Medical Association.
It'll come out.
And he spoke very clearly last night and this morning that this is a hidden pandemic, kids' emotional health, and schools have to reopen. He's taking a very strong stand, which I completely support. And I'm really going to work hard to get this, to continue to follow the data, but to stay in that important space. So I'll stop there. Someone's going to have to manage the chat box because it's awesome.
Right.
And I'll see what I can do in the next 10 minutes with you.
Okay. Thank you so much, Brina. I also want to remind all of you present that we will be seeing Brina again next week. She'll be joining with the pediatricians panel. So here we go. Starting with the first question. You can go ahead and read it, Brina, and respond. You see it? Will the Department of
I'm back.
Education...
Okay.
Will the Department of Education and Department of Health be creating a training that is directed specifically to education facilities?
Oh, that's a good question. I don't know. There is a required training for anything reopening at the VOSHA site, which is occupational safety, at the Department of Labor, that you might, it's called a training. It's just a PowerPoint slide deck, no audio. I would imagine if this is something that you think is important, we need to get this up front right now with our Agency of Ed colleagues. Ted might be on. I think Ted Fisher was planning to join. And yeah, Claire, I'm sorry, I'm trying not to read the chat box, but I just did. So Claire's saying, of course, VOSHA is not applicable. I get that. I just wanted you guys to know at this point now in May, before schools reopen, you could take a look at that to see some of the high level guiding points. So I would say, if you need this, we should do this, and Agency of Education and Department of Health will do it together.
And Ted's not on right now. If I do see him, I'll message him about this.
Okay. Yeah. I mean, there are a lot of tables at AOE that are forming about all of this. And, I've been advocating for public health and epidemiology at those tables. So that's all real time. I think the guidance coming out yesterday for the other entities, is a nice sort of roadmap to get started to think about some of the many, many, many considerations that have to get in place for successful reopening of schools.
Okay, so the next question is, has any thought been given to a data collection tool to be used to give real-time school nurse influenza COVID-like illness symptomatology prevalence to the VDH as we did with H1N1?
Yeah, absolutely. So, correct me if I'm wrong, but some of you already do syndromic surveillance for public health. I'll double check on that, but that was a big part of my school health work over the decades is the importance of school nurses in syndromic surveillance, which is exactly what you're describing here. So yes, but just collect all this, because these are all the things we don't want to forget when we're starting our, when we're engaging with daily.
It's all going into a spreadsheet that we're trying to track, so we can get the once we get the answers, we're presenting that and sharing that with everybody that's interested on our website.
Excellent.
Next question is, reimagining the health office services will take more than working it out locally. Pediatric offices are separating ill from well visits and making other accommodations to decrease potential exposure. School health is often delivered in a walk-in closet without windows or airflow of any kind. Dr. Holmes, will the medical experts be giving specific parameters or guidelines so that school health offices can prioritize COVID-19 and influenza mitigation when school reopens?
Yes, 100%. Nothing is going to look the same. The facility questions are of deep interest to us, and we're already grappling with them in childcare. And Sharon Lee answers questions about this daily from our childcare providers. You can't have a walk-in closet. You have to have a sink. You have to have separate space for sick kids, and you have to have, walls or very significant protective for respiratory droplet spread. So I'll stop there, because the answer is just a really capital yes.
Great.
And then I recognize it's going to be a major lift for facilities.
As we think about return to school protocols for schools and the health office, it seems that children don't run fevers with COVID as much as adults. All symptomatic people would be fully assessed, but as we talk about temperature taking on entrance to the health office, as a middle high school nurse, I wonder when the break point comes between children and adults.
Okay, so first of all, great. This is why I love being with you all. This is exactly right, except I will tell you one thing. We just did a health alert about the symptomatology of adults, and they don't have fever either. It's 50% of people, kids and children, children and adults in the Vermont experience that are have fever. So that I'm just airing it out with you guys. So temperature check is important, but it's not paramount. It's not like oh my God, I'm so relieved this kid doesn't have a temp. But we are still recommending it, and it's better than nothing. But there isn't actually a distinction with kids and adults. This whole, the spread of symptomatology of this virus is getting broader. And, one of my side jobs, I'll just tell you really quick, was I had the job of calling back all these corrections officers who were experiencing, they had been tested and they came out positive, some with very minor symptoms, some asymptomatic. And then I was just doing some of the health work with them. So many of those guys had loss of smell and nothing else. It was astounding. And I can't even tell you how much I poo-pooed that in the beginning. I didn't understand it, and I was waiting for it to be, described in the scientific literature, and now it's a real thing. So I don't want to go too far on that, but I did want you to know that health checks and health screening and temperature checks are still part of our future, our present and our future, but they're just one piece of the puzzle. Okay, next slide. Can someone keep track of time, because I don't have my watch on? I'm worried. I have to talk to the children's directors of the mental health agencies at 10.
Okay. So maybe you can do timekeep. So when so many are asymptomatic or do not have a fever with COVID, why is there such a focus on temperature? I think you just
I just addressed that. It's because it is an important data point. It's just not the only data point. Okay. And I also think it's just an opportunity to stop and just ask those questions. There's more to it than just temperature, and just slow everybody down to say, we're just going to stop for a second. Have you been around anybody that has this? Have you been around people, that have been tested positive? And how are you feeling? Like, you stop and you slow down. And we've broadened in the new guidance. We added many, many more symptoms to ask than just fever, cough, shortness of breath. We added the muscle aches, we added the headache, we added the sore throat, and we added the loss of smell. So it's more, the health screening is not just temperature.
Got it. I think that answered the second half of that question too. Thank you. We need active practicing school nurses at the table with the Agency of Education. Can you advocate for that?
100%. And Sharon Lee does this every day as well. So, and you know, I mean, this is my drumbeat, and I want it 8 times 8 ways. So I will do it at every table I'm at, and I want you to do it at every table you're at.
Thank you.
Yes. Okay. I'll just
Very much appreciate that.
no, I gotcha. I didn't want to forget to ask, did any one of you get invited? There's a association of private schools in New England that wants a panelist at the end of May to talk about reopening of schools. And I suggested VSSNA. The guy's name is something. Anyway, I'll double back with you, Soph, but I think those kind of opportunities are excellent because we elevate school nurses when we're on panels and able to talk in sort of regional and statewide presence.
Great, thank you.
Will there be any guidance for independent schools like Baird School or at Howard Center to employ TCI strategies and daily have to engage in restraints, escorts, etc., bringing staff and students very close contact?
Oh, that's super interesting. So what I'm going to put this question in the category of sort of special circumstances that are going to need a lot of kind of creative thinking. You know, this reminds me a little bit of how we talk to folks that work with toddlers. You know, you don't physically distance toddlers very successfully, and then what to do about cloth facial coverings. I think that working with people that are going to need physical engagement is a whole other kettle. And so I guess I would say yes, in that we've had ongoing guidance and worked with mental health and DCF about special circumstances and special populations, but this one is not easy. So I can just tell you that we're talking, but without answers.
What are the guidelines for students to go into the schools to clean out their lockers before next school year, and teachers to clean out their classrooms of personal belongings?
You know, I'm going to let Sharon Lee answer this. She's been going back and forth with Ted about this, and I don't know that we have an answer yet. Sharon Lee, did we get some clarity on how to do this?
I muted you, Sharon Lee.
We haven't had feedback from Ted, but the guidance is going to still be the same with the room with a number of people and face covering and hand washing.
So they're going to limit the number of kids that can go back and get their stuff, I guess.
If we follow the guidance for childcare, which is, you know, currently 10 people to a space, but if it goes to the 25, then, but it's still like keeping the physical space and face covering and hand washing.
Yep.
Will obviously be part of.
Well, and I could tell you guys that because it's in the guidance. Our intention on June 1st, which is written, is that group size goes to 25. And that's only if the data holds and the epidemiology allows for it. But it is, and we needed our childcare and summer programs to be able to plan. So we told them that yesterday in the guidance. I will tell you also that we hope society goes to 25 that same day so that it isn't some sort of exception thing, like still stay in groups of 10 regular Vermonters. But if you're going to go care for children, go ahead and put 25 together. There's a incongruence to that. So that was a little sneak preview for June 1st.
It's 9:50, Dr. Holmes.
Oh, you're great. Let's do 2 more.
Okay. Are face shields acceptable for school use for teachers and students?
Yeah, great question. My understanding of face shields from my medical background is they don't cover the mouth. So I need you to help me. If it covers your mouth and your nose and your eyes, yes. So if they're like a welder's thing that pulls down, yes. But a lot of people say face shield and they mean something that's like nose up. And so obviously you guys as medical people know mouth, nose, eyes.
Okay, so I think that answers the second half, which is, are they protective enough, and does it make sense to recommend face shields for teachers, especially in primary grades when teaching phonetics?
It's a great thought. I think probably, I mean, there are cloth facial coverings and masks that have cutouts at the mouth for especially people who are hearing impaired. And it's called the communicator. If folks want, we're actually working to get some for our children with special health needs team. So these are the kind of things I want you to use your best nexus of science, medicine, and creativity, whatever you can do to keep the mouth, nose, and eyes covered, but meet the needs of kids. I support. We support. here's the thing. The childcare folks think they can't do like serve and return with little babies with their mouths covered, and that's not true. There's some really great videos and studies about the use of eyes as the way we communicate with our babies. So that's just a little sidebar, but this is an extraordinary time. So if we can't teach phonics without our mouth, which I don't know enough about teaching phonics, then you need to get something that shows your mouth, and a face shield is fine. Okay, one more.
Okay, so
Here we go. Here we go, supplies. I'm ready.
Yeah, so will the state be securing supplies for schools?
Yeah, I mean, so I can only tell you what we're doing with childcare. The State Emergency Operations Center is fully activated that we can't open childcare without adequate supply chain. And we're also, but the difference that we have to talk through with school funding, we're giving grants to childcare starting in June, which they're going to be using for the purchase of supplies. So this is an advocacy point. So the answer is, yes, I hope that the state plays a role. I imagine they will, because this is, one of the top priorities of our response. And then who pays for it is like way beyond Brina. But it's sort of 8 times 8 ways. I think what we've done with childcare is some folks have gotten their own, and then other folks have gotten it through some advocacy, and I don't have preferred vendors. It's just, and you guys may play a really important role with BGS on that. Do you call it BGS? That's what we call it, the building folks, to say, like, this is my sense of this volume of kids coming into my building. I need, 45 tubes of this and 26 containers of this. And this gets asked of me a lot, and I don't know enough about the volume. I know what you need. I just don't know the volume. And we have a nice checklist. It's going to go into the appendix for the childcare and summer program guidance. It's not out yet, with a checklist of what you need. And then maybe you guys could play a role in quantifying it in a way you advocate in the budget, because it's just about, people talk about back order and out of stock. I think that's true of thermometers, but not so much the other supplies. We actually can get them. I'm so sorry, I should stop. Gosh, that's such a bummer. I would like to talk to you all day.
Dr. Holmes, can I just say something very quickly? So with everything you just said, logistically and for bang for the buck, if there was a way, even if the school districts themselves paid for the supplies, but we did a bulk buy, so there was a way to do line items. If the Department of Health had a recommendation for specific thermometers and things like that, but if we were able to buy a whole bunch of infrared thermometers as a group, we would get a much better price than if each individual buys theirs.
Well, maybe you should do maybe you should form a subgroup at VSSNA about supplies and work directly with Sharon Lee, because we can tell you what thermometers we've heard are, the best, not the most expensive, but the good enough ones that are in the $25 range, and we can give you those recommendations. I'd be happy to do that. I just want you to, get out ahead of it a little bit, because this is all about preparation.
Yeah, and we have a subcommittee already set up with a bunch of nurses around the state talking about PPE. So that would be definitely a direction we'll go with that. And I know it's 9:55, so I think you have to go. So
I do. I'm so sorry. See you again soon.
Okay,
bye.
Bye-bye.
Thank you, Brina.
Okay, so I'm Sharon Lee. We'll continue, and and here we go. So will school nurses now have to assess and keep records for staff? There can be many staff who enter the building very early in the day who will monitor, maintain, and enforce. And where will that information be stored, and who will it go to?
So good morning. And when I opened this morning with your 4 wonderful leaders, I shared with them that I was ready for the firing squad. And I shared with my colleagues yesterday around the nation. And so they sent me condolences from across the country saying, join the club. This is what it's about. We are doing our best to look at tomorrow when we have no idea what it's going to look like. So with that being said, let's go for it. Will school nurses have to assess and keep records of staff? I think that's a question that you folks will need to answer. Is that really the role, if somebody is going to be keeping records, should it be a designated health safety officer that you have trained in confidentiality? That would be HIPAA and Americans with Disabilities, because there are going to be adults who, if they choose to come to school, will not want their information shared. So does that really need to be the school nurse's process? So that's a question for you folks. And specific thermometers, we've not had a list of specifics recommended at this time, and we're all in the same boat with vendors. I can tell you what I learned from in terms of money, and it's in a slide that I sent to Clayton if he wants to pull it up. But we can talk about that a little bit later in terms of money and what's happening with the ESSA or ESSER, from the federal government, funds that are going to state education agencies. So there is, you all might know that there is money that comes from the federal government to the state of Vermont and then goes out to all the schools. There's two paths of which money has been coming to the state. And I will ask all of you, this is what we need up here on the firing line, that we're all in the same boat of not having the answers, but what I need is somebody to research the funding that has come to Vermont, and that would be should be on the Agency of Education web page with their budget. It may be in the State Board of Education minutes and notes, but Dr. French, Secretary French, has that information and they've been working with it. So the two pieces that relate to education, or ESSA, Every Student Succeeds Act, it came inside of the CARES Act from President Trump. And the two pieces that will come or have come is one for education, it goes to the governor who can decide how to use it, and the other comes to the state education agency, so to Secretary French. And that money comes through the, and I can't tell you exactly which slide, but if you keep, it's probably down on slide 17, perhaps. 13, slide 13. Oh, yeah. So the two in the bottom of the blue. So Governor's Emergency Education Relief Fund, and then the ESSA's Emergency Relief Fund. And they come through the ESSA one, at the Emergency Relief Fund, comes through the Title I programming. So every school gets a percentage of Title Funds money. So that is here. It's going to be here for the next fiscal year, and it may go into the fiscal year of 2022. Just so that, to keep that in the back of your mind, that when you make a request that asks for more funding, there is money. We just have not heard, and I would ask one of you to explore the Board of Education documents and see if you can find where that budget is. And maybe I see a couple people who are familiar with the board on here, and some of you may know how to access that. So thanks.
So I just have a clarification question, Sharon Lee. Are you suggesting that this money might be a mechanism to increase school nurse support or supplies, or what are you?
Great. So that's how other states are using it. Other states are using it. It's available for professional development, for staffing, for training, for supplies, for which it actually has always been, but so it's just more money in that pot. The answer is yes. So,
okay.
Are there other slides you want me to go to, Sharon Lee, on this presentation?
not for that. You want to I'm happy to go back to the other questions. Thank you for flipping through all of that.
I'm getting there.
Because I know that you all.
So hopefully now you're seeing that screen again.
Yep.
And I think we've covered all three of those questions.
Thanks.
How do we protect our staff and children with disabilities that prevent the child from wearing a mask, although they may transmit droplets through drool, spit, etc.?
So I think Brina has kind of answered that. It's really going to be up to the creativity of the team, the family, and what works. Working again, these kids will be, not these, anyone with a disability is going to be needing to work with their medical provider to find out what's recommended. If they will be returning to a group with many people, a congregate setting.
So what's the latest on immunization requirements for K in 7th grade? School nurse? Sorry, go ahead.
They're staying the same. That will continue. I can tell you that the American Academy of Pediatrics is most concerned that schools would relax any of those requirements because kids are even more vulnerable to disease and need to stay current on their vaccines.
And the second half was, may school nurses obtain verbal consent from parent or guardian in regards to religious exemptions for the upcoming school year?
I don't think the immunization requirements are going to change.
Okay. Are schools going to be expected to check student and staff temperatures before they enter the building, even before they get on the bus? Our administration is under the impression that this is an expectation. What will busing students look like if that is their point of entry in the school system and they don't have their temperatures taken at that point?
Yeah, those are great questions. I don't have the answer.
Okay. What is contact tracing going to look like if we have students in our schools who test positive? Are you going to alert the school nurses?
So the way it's working with childcare is that anyone who is referred to their provider will be tested with the order of their provider. And when the test comes back, if it is positive, the health department will be in touch with that individual and will identify the people that they are in contact with that meet the criteria for close contact. So that's how it will continue.
Should we keep pre-K and K classes separate due to social and physical distancing within this age group? This will be with this age group will be difficult.
So Brina's little heads up on the number 25, the way the guidelines are currently written, it says 10, but as of June 1st, if it's 25, that means that group has to be separate, kept separate from the other groups. So it depends on how you define a group. That group should not change because that's how you minimize your disease spread, obviously.
Has there been any discussion around extending prescription expirations for medications? For example, students who require epinephrine autoinjectors, inhalers, etc.
Well, I'm not really sure what you mean extending prescriptions. You would always want to have a current prescription.
Okay.
So much has changed and it's going to change much faster. I may have said this before, but we are not returning to anything. We are moving into something entirely new. And so that is one of the things that I would not expect to change.
Okay. When do you expect guidance for an exclusion criteria for schools to come out?
That's what's on the table with the agencies that we need to continue to work together. The one thing that has not changed is the fever of 100.4. But again, that's American Academy of Pediatric recommendation. There are many examples. There's tons of examples of what those exclusion documents. I've had some wonderful ones from across the country that we can use, or you're welcome to create anything you create in your groups can be submitted to the VSSNA for approval or acknowledgement and submitted to the School Nurse Advisory Committee.
Are there any evidence-based screenings that you recommend school nurses use using as students return?
So I'm not really sure what this means because all of the screenings.
Actually, it was in regard, sorry to interrupt, and I was thinking more socio-emotional when I was listening to Brina talk about, and something that could help DCF if we return to hybrid sort of situations. So it wasn't in regard to COVID, more socio-emotional stuff. Sorry to interrupt.
That's a fabulous, Katie. Thank you for bringing that up. I think that is what we as nurses and school nurses do every day. When you see anyone on the street, even, don't tell me you're not already looking for signs of health and wellness or areas where they're missing. So I would hope we would continue to do that. Again, when you find those tools, send them to the VSSNA, and the VSSNA can forward them to the School Nurse Advisory Committee, or it can submit them to me directly. There was a lot of excellent research done in Missouri after the floods, severe flooding. The school nurses did some tools. I've tried to find those checklists, but hopefully we can get those folks to share their research. But it was extremely well done and was published in the school nurse journals. They had very good results. They did some screenings and they did some interventions and had excellent results with the interventions.
Are there any guidelines for situations where restraints, escorts, and seclusion are used in a mental health camp setting? I think that was already addressed earlier.
Yeah, that'll have to go through Department of Mental Health.
And let me go back. I'm sorry, I'm just making sure that I have the right questions here. Okay. School health supplies, no masks in stock. Where can we get masks? Do you have any recommendations?
So I think what Brina was trying to say earlier was the State Emergency Operations Center. That is the, so DCF was working with State Emergency Operations Center to make face coverings and gloves available to childcare providers, and it goes through another organization who's managing that process for childcare providers, for regulated providers. So that's a question that we need to activate Dr. French's office on that. They're the ones who would have to work with the State Emergency Operations Center.
Thanks.
And masks do.
I'm sorry, I didn't mean to interrupt you.
No, go ahead.
What I've been hearing is that it will be impossible for staff to do the cleaning and disinfecting, et cetera, with the 1 to 2 people who work there. We did not have PPE. I cannot find out where and who to contact. I ordered from VDH, but was told that they didn't have any. I talked to Let's Grow Kids, and they closed the program. I gave the secretary a wish list, but we do not know where to get it.
Join the club.
Okay. So does that go back to your Secretary French? It sounds like that's where the request has gone to, but continue working with the AOE?
Yes, that's for surgical masks and gloves. Face covering for kids and staff. Again, that'll have to go through the AOE.
Should we be using VOSHA guidelines for staff currently going into schools?
I don't know why we wouldn't. It's required of all businesses and nonprofit organizations is the language on their website.
Okay. I
did ask, Brina was talking about Ted Fisher, and if Ted, if you're on, please jump in, but I did ask about that, and he's working with the secretary on that.
And Sharon Lee, I think that one of the things, when we had an email exchange the other day about this, but the central office is a business. So the central office obviously would have to follow the VOSHA. And because there's no students in schools, it would probably make sense to follow those for safety of staff members and for the maintenance folks that are in the schools and anybody else that's working in the school to help protect. And I had seen a comment in the chat room that said that, you know, VOSHA doesn't directly apply to schools, but in this instance, it makes sense.
Well, the language on the website says businesses and nonprofit organizations.
Okay.
And all state employees. So everyone at AOE, we all were mandated to take that 5-minute training.
Okay. Will they be guidelines or requirements? Because requirements have more weight than guidelines.
Well, I think you're watching be very generous in modeling and encouraging people to wear face masks face covering, for example. There's an article that's in my notes that references 5 common reasons why people choose not to follow health guidelines. And primarily, our role is to model what is best. And when you make a mandatory, when you draw the line in the sand, what do people do?
Okay.
That's what I'm seeing from the governor.
With most recent VDH data on COVID positive patients in the state, fever is showing up less than 40% of the cases. Any idea if we're going to move away from mandatory screening protocol?
I think you've heard from Brina on that.
Thank you. Is there really enough time to prepare buildings, get supplies, et cetera, prior to September?
Only our joint creativity is going to make that happen.
Has the efficiency of the antibody test improved at all?
Yes, the efficiency of the test, I believe, has improved. The using the findings has not. There's no passport to immunity right now. I am putting in the bulletin an article about, it'll come out on Monday, about herd immunity, in that there's apparently some science about how the individual develops immunity, but there's no promotion to expose people unnecessarily to disease. And it's not recommended.
What is your opinion about the recent news articles about emerging multi-system symptoms in children? 100 cases in 14 states now.
Yep, so that's a great question. That's one of the VCHIP presentations that occurred, I think, last week. There will be an article from New York that addresses that as well. That may have been, yeah, that'll be available in the bulletin.
I don't mean to interrupt you. Hi, Sharon Lee, it's Susan. I wrote that question lower down. Clayton, you can disregard my question lower down, because I was just clarifying that they were considering it a Kawasaki type disease. Dr. Fauci had renamed it, but I forgot what he named it.
Yeah, he has a different name for it, and it's not rolling off my tongue either. What we know is that children are testing negative for COVID-19. However, their serology test shows antibody response to a previous infection with COVID-19.
I thought the recent news article said that many of those children were positive.
That may be a different news article. The research in the literature and the thing we just had reinforced yesterday is that kids with that syndrome, and it is not Kawasaki, it just has many similarities. The majority tested negative for COVID-19. The majority tested positive for antibodies to it.
And the next question I think already got covered, but are we finding any symptoms that are unique to children?
I don't think unique, based on, and you know, like Brina says, I'll let you know tomorrow the mistakes I made today, or or in my case, I won't have time to let you know about all the mistakes I'm making here. But what I hear from the medical community here is that the similarities are symptoms are similar. There was one thing that did pop up, and that was gastrointestinal symptoms seem to occur quicker or more commonly in kids. That may be the first sign for kids.
As we go back to school, can the Vermont Department of Health weigh in on our sick day guidelines? When to exclude a child? How long to
good.
keep out home after illness?
Yep, I think we've talked about that. So send me your recommendations and we'll put them in the queue.
Okay.
I think we can be sure that I'm going to put my life on the fact there will be a single document that recommends the exclusion criteria for every single school in Vermont, unlike our current mishmash of, oops, I didn't say that.
Gotcha. Thank you. Continue to predict that history/temp taking will occur when schools open in August, and how do we?
No prediction.
I'm sorry.
No prediction.
Okay. And how do we anticipate a large district or school will master this task? So
there is a little video in the notes that I had prepared today. It's about 30, well, maybe a minute long, showing you what Canada is describing will happen in their schools. Good luck. I think you're going to have to be creative. You're going to have to train others. You're going to have to ask others to rely on their willingness if they want to address the needs of children and families, particularly mental health. We're not talking economics, we're just talking children's well-being. If people want to address children's well-being, we have got to be creative in how we can train others to do tasks that help people be safe. Who's going to monitor putting the signs up? Who's going to model wearing face coverings? Who's going to put the marks on the floor to keep people at separate distances? Who's going to put tape on the floor to keep, groups from not touching each other, or put plastic between barriers, or provide visible something that you can see through where you're observing a child who's sick, where you don't want to be in there because they're coughing and sneezing and they have a fever of 103. Who's going to help set those things up, and how creative can you be to make those things safe, and advocate for the cleaning that needs to occur? What kind of staging, what kind of slow transition back to, not back, transition into the new world of education.
So any guidance for boarding schools or residential schools?
Not at this point.
Okay. The delays on obtaining thermometers and supplies are up to 8 weeks out. Can they get these grants now in order to order the supplies?
I want to go back to that one, but we'll go back to the higher education. So again, now residential schools, that makes me think of colleges, but if there are kids there with IEPs, there will have to be a way to address that. So those special situations are not being ignored. Please don't ever think that they're being ignored in any way. It's a serious concern. Okay, we can go ahead to the next one.
So that was the delays on obtaining them. Do you think that the grants available now to pay for this?
You're going to have to go through your business office and explore the budgets there and at the AOE.
Okay. Do you know how the percentages are calculated by school for disbursement by number of students?
I can only tell you what I know from my colleagues out of state, and that is, it follows the Title I funding. So whatever the Title I funding formula for Vermont, it may be, this is not, I have not studied this. I can only tell you what I've heard from other states, and I do know that the Title I funding is a formulary process, and what Vermont chooses for the formula to keep at the state level or to give pass through to the schools, you'll have to look at the school Vermont Board of Education notes and things.
Question came up yesterday about driver's ed and 2 to 3 people not related in cars. Is this possible? Not probable?
6 feet, again, I think that has, there may be a link on the AOE website for that.
Well, I know in the last addendum, it said that only 2 people could ride in a vehicle for work crews. So, and so do you think that that possibly could in some way be extrapolated to what can happen for schools?
No, I'm suggesting that the Agency of Education has, I thought, had a statement on driver's education.
Okay.
And it may not answer this question, but.
What will it look like if parents choose not to send their children to school when it does reopen? Will educators still be responsible for remote learning for them?
That's a great question for the AOE.
Do you think, just to add on to that, just thinking out loud, but students that have special health or chronic health conditions where there was a concern from the parent from that standpoint, do you think that would be looked at differently from a health perspective instead of agency of ed?
The same for kids as for adults.
Okay.
Those of, yeah.
Can we clarify if we are talking about masks for staff or for students?
Face covering for all.
Could PTOs be asked to make masks?
I just love your creativity. Yep.
What do you think the VDH will create supply? Do you think the Vermont Department of Health will create or supply posters for persons trying to enter school? For example, if you have respiratory symptoms, please do not enter.
That's a good question. There probably are some on CDC website. I know we have, there's a poster for childcare, but it's really about stop here. If you've got symptoms, go away, kind of. And I mean that respectfully, using respectful language. So I anticipate something will be created.
So I will pass along that ACCD, which is what's mentioned in several of the executive orders and addendums. If you go to their website, there is a section that actually has all kinds of signage in there.
Yes.
They already made, and it had to do with the VOSHA training, but that signage is available. So if folks go to that, I can't copy and paste a whole bunch of different things at the same time, but it's pretty easy to find on the ACC.
Yeah.
web.
Yep. Again, the VOSHA link was in the bulletin last week. It'll be related to another link in the bulletin Monday, and language. I think, just being creative here, if you take any verbiage and put it on Google and say, translate it, you can do that. If you have a known population that's not represented in the 16 or 13 languages on the health department's website, it is the responsibility of the A to work with their student support system and find somebody to provide that. So those are, I would just go to your student support person and them to.
Karen, not to interrupt, but Colleen answered part of this question down below in the chat. But it's there are a lot of languages represented in these handouts. So I would just go to the CDC website or to our website and just fish around, because I think you're going to find a lot of the things that you're looking for already. And they weren't specifically designed for schools, but they apply, such as don't enter the school if you have any symptoms, or period, don't enter the school. So you can just find what you need and use it.
So I want to thank Karen Nelson, one of our school liaisons, one of many who have been conscripted into the new army of, keeping contact tracing and many other duties around COVID-19. So thank you for that, Karen. And also, there's two leaders on here. One I spoke to yesterday, Liz Mans, and one who was honored School Nurse of the Year a year ago, Mrs. Anderson. And I know that many of you have asked about how do you get to the table with leadership. If the group is willing, I would like to invite them to share their wisdom as to what is most successful in getting to the leadership table. This looks like you're still muted, but if you want to speak to that, is that okay with?
That's fine.
Great. Well,
we actually only have about 3 minutes left,
Exactly.
and there's a couple more questions, and then maybe we could do that.
that sounds fine. Continue with the questions and I'll hop on after.
Thanks.
Great.
So what does the VSSNA stand on summer programming? Is the Agency of Education aware of it? Soph?
The VSSNA is deferring to guidance from the Department of Health at this point.
So that is in the document that Brina spoke about for summer programming, and that refers to the numbers and the screening and the guidance for keeping groups separate.
Will there be any guidance for students who are not able to follow health guidelines due to behavioral issues?
That's going to be up to the creativity of your teams. We recognize that's going to be a terrible situation in terms of expecting an answer right away, and it's going to have to be kind of created or think through, do a tabletop exercise, take an example of what's happened with a student in the past and say, okay, how are you going to protect yourself and the staff and families, working with the families and how to work that out.
Okay. So that was the last question. So if Liz, if you can unmute now, that'd be great if you could share for a sec.
And I see Jenny is unmuted as well. Thank you, Jenny.
Sure. When I spoke with Sharon Lee yesterday, she asked if I had any ideas willing to share with you about meeting with superintendents, how to get at the table. I kept this little note card right by my desk. I keep it by my phone. Remember, it's all about relationships. And you need to start as soon as you can, building and continuing with that relationship with your principals and your superintendents. Make sure you're fluent in what the superintendent principal's priorities might be. They might be different than ours. We are the nursing and health experts. They often need some guidance to know what our priorities are as we do for them. Right now, I think many of our priorities are going to mesh, reminding them that we have specific skills and knowledge that are incredibly beneficial as we restart schools with this new perspective of whatever life is going to be. We are stronger as a united voice than singly. So be sure that when you are communicating with your administrators, that you make full resource use of all the good information that VSSNA has, as well as NASN, as well as the Department of Health. Speaking as a group, we are far stronger than speaking alone. We should always be anticipating potential issues that come up. We have a unique understanding of schools that is crucial for administrators to get, to understand. So nurses are always looking ahead to what potential problems may be, but communicating those ahead of time with your administrators is key. Those are the big ones. Also, just keeping in mind that whatever we do, as long as our focus is on what is best for the students, what is best for our school communities, as long as we keep that as our guidance in what we do and our decisions, we're headed in the right direction. Communicating, building those relationships, persistence, and consistency. Those are the keys. Thanks.
And Sharon Lee, I'm sorry to cut in real quick. So our time is up right now, and I know that we want to have Jenny speak. If we just wanted to say thank you for everybody for joining us. We know some folks have to go to other meetings, but we can stay on for probably another 10 minutes, I think, to support some other questions. But before we do that, there was one last question, which was, can you, at what age are we expecting children to wear masks at school? I don't think we talked about that earlier.
Children can be expected to wear masks any age over 2. If you're modeling it and make it fun and safe and practice doing it, don't underestimate the power of kids to mimic and to want to be safe.
Thanks. Jenny, go ahead. And I'm sorry, I didn't mean to cut you off, but I wanted to make sure that we could acknowledge that folks could go if they needed to.
Yeah. I think she covered it pretty well. I would say persistence, communication, that, we understand that they have a million things happening, but that in this particular situation, this is a health crisis and we are the experts. And, sometimes my friend always says, what is it? You get more bees with honey, or whatever that saying is. Trying to be strong, but also being very diplomatic in what you're trying to present, and also being really clear. I always make a list when I'm doing the communication so that I have a real idea of what I want to cover, so I'm not like all over the place. I think she covered a lot of the things that I would suggest.
Great, and thank you for sharing the sunshine. For someone standing inside of a cinder block room, it's really great to see someone.
Thanks.
So that is all. So all the questions that were asked, we tried to capture everything from the chat box. Somebody asked a question. This is being recorded and will be posted on the VSSNA website later today. We will also post the questions, and I think that we've captured the answers, the essence of the answers, in a spreadsheet that we'll put up as a PDF so folks can read through that. The items that weren't addressed, we will work with Sharon Lee and crew about getting those answered also, and we post those after the fact, and you'll just have to check back to see when those go up. So Soph or Becca, if you have anything else, I'm going to mute myself, and then we can end this when you guys are done.
I just want to, again, thank you all for being here. We have such amazing expertise in this state, not just those that hold high positions, and we really appreciate your insight and your input. Sharon Lee, thank you for feeling like you were going to be on the hot seat. I hope it didn't end up being that way quite so much. Sometimes anticipation is worse than reality. So as questions come up, as I know that they always will, please send those questions to covid19@vssna.org. And I just want to share, I really appreciate the effort that everyone is making to make that connection with their leadership team. I feel like I'm making a little bit of progress in my own district, and that's exciting, but we can't stop yet, can we? So that's all I have to say. We look forward to seeing you next week, Thursday.